The increasing frequency of deadly viruses jumping from animals to humans is not a coincidence, nor is it a temporary phenomenon. It is a growing crisis fueled by environmental destruction, human encroachment into wildlife habitats, and globalized travel. The warning signs have been present for decades, but they have been ignored, underestimated, or dismissed as isolated events. However, the reality is far more alarming. Pandemics are not anomalies. They are becoming a pattern. Experts in the ARD documentary Spillover, Planet Derviran stress that COVID-19 was not the first global outbreak of this kind, and it certainly will not be the last. In fact, we are heading toward a future where such spillover events may become frighteningly common. The list of viruses that have jumped from animals to humans is already long and growing. Ebola, Marburg, Nipah, hantavirus, and multiple strains of avian flu. Each of these outbreaks has caused suffering, economic devastation, and in some cases, catastrophic death tolls. What makes the situation even more dangerous is that many of these viruses have far higher mortality rates than COVID-19. An Ebola outbreak, for example, can kill up to 90% of those infected. If a virus with similar lethality were to gain the ability to spread as easily as the coronavirus, the world could face a disaster beyond anything previously imagined. Scientists like Colin Carlson, a biologist at Yale University, warn that the frequency of such events is accelerating at a disturbing rate. He projects that by 2050, there could be 12 times as many spillover events as we see today. This is not speculation. It is a logical consequence of how human activity is transforming the planet. Deforestation, intensive farming, and the illegal wildlife trade are pushing humans and wild animals in a closer contact than ever before, creating more opportunities for pathogens to cross species barriers. Meanwhile, climate change is driving animals to migrate to new areas, potentially bringing unknown viruses into human populations. One of the most dangerous aspects of this crisis is our lack of preparedness. Despite the devastation caused by COVID-19, global health systems remain fragile, and political responses to emerging threats are slow and reactive rather than proactive. Many countries still struggle with basic surveillance for new viruses, and misinformation continues to undermine public trust in scientific warnings. If the lessons from past pandemics are not taken seriously, we will be caught off guard again. And next time, we may not be so lucky. There is an urgent need for a new approach. Governments must invest heavily in pandemic prevention, which means strengthening early detection systems, regulating wildlife markets, and enforcing strict biosecurity measures in high-risk areas. The scientific community must continue studying the vast number of unknown viruses circulating in animal populations, mapping potential threats before they reach human hosts. And at an individual level, societies need to rethink their relationship with nature. Our reckless exploitation of the environment is directly contributing to the emergence of new diseases. Ignoring this crisis will not make it go away. The forces driving spillover events, climate change, deforestation, industrialized agriculture, are accelerating. If current trends continue, the outbreaks we have seen so far may seem mild compared to what is coming. The question is not whether another pandemic will occur, but when, and whether we will be prepared when it does. The choices made today will determine whether the world faces a future of recurring global health disasters or finally takes the necessary steps to prevent them.